Friends, welcome to A to Z Dentistry. This video focuses on important MCQs related to diseases of maxillary sinus. Largest paranasal sinus is frontal sinus, maxillary sinus, sphenoid sinus, ethmoid sinus. Maxillary sinus. First developed paranasal sinus is maxillary sinus. It is pyramidal in shape. Antrum of Highmore is frontal sinus, maxillary sinus, sphenoid sinus, ethmoid sinus. Maxillary sinus. Maxillary sinus, otherwise known as antrum of Highmore. Apex of the maxillary sinus set, alveolus of maxilla, lateral wall of nose, zygomatic process, inferior orbital margin. Zygomatic process. Floor of the maxillary sinus located at alveolus of maxilla. Lateral wall of nose forms base of the maxillary sinus. Apex located at zygomatic process and inferior orbital margin forms roof of the maxillary sinus. Maxillary sinus infection of odontogenic origin commonly caused by aerobic bacteria, anaerobic bacteria, virus, fungi. Anaerobic bacteria. Drainage of maxillary sinus difficult because it is small in size, narrow opening of maxillary sinus, the opening lies at higher level than floor, all of the above. The opening lies at higher level than floor, so the drainage of maxillary sinus is difficult. Oro-antral communication most commonly occurs during extraction of maxillary first molar, maxillary third molar, maxillary first premolar, maxillary second premolar. Maxillary first molar. Oro-antral communication is an unusual communication between oral cavity and maxillary sinus. These complications are most commonly during the extraction of maxillary first molar. Caldwell-luc surgery entered to maxillary antrum through incisive fossa, canine fossa, pterygomaxillary fossa, buccal fossa. Canine fossa. Caldwell-luc surgery is an extraoral approach for surgical treatment of severely diseased maxillary sinus. In this surgery, it enters to the maxillary antrum through canine fossa. Intranasal antrostomy done through inferior concha, inferior meatus, middle meatus, superior meatus. Inferior meatus. Intranasal antrostomy done through inferior meatus. It's all about the topic diseases of maxillary sinus. See you with a new video. Thank you.